Greetings, it's New Zealand naturopath Eric Backer, author of Candida Crusher and also formulator of Canxida, the Canxida range of yeast infection products. I've got a question today from a man in Maine, New England. I thought there was one England, but apparently New England is several states there on the east coast of America. So this man's called Terry from Maine, and Terry's asking me, Eric, are there any side effects with this antifungal product, Canxida Remove, that you've created? So Terry wants to know that. Well, I wouldn't really call them side effects. Side effects to me really are something that are produced by pharmaceutical medications, and we call that iatrogenic disease or drug-induced disease. So side effects are undesirable effects caused by a product. Any kind of product you take can create effects in the body that are undesirable. Okay, so some people call them side effects, some people call them undesirable effects. Most of these effects occur not due to the product but due to the person, and often it's because of bowel or liver toxicity or some degree of kidney congestion or kidney toxicity. So the common things we find in people is liver congestion, fatty liver. Lots of people have got fatty liver or sluggish liver from alcohol, sugar, pharmaceutical medications, high stress lifestyles. These things all create liver congestion. And of course then when you start taking a product and it starts killing and removing organisms from the body, these toxins can further clog up the liver and create brain fog and cloudiness, and all sorts of disturbances the person can feel. Other common thing that I would see with patients really would be changes that occur to the digestive system, because the digestive system itself has a very powerful immune component about it. Secretory IgA is an immunoglobulin produced in the small intestine. Between 1 to 1.5 grams per day your body makes of this immunoglobulin to tackle things and get it out of the body, to bind to pathogens and remove them. So when we start again killing bacteria, parasites and candida en masse, and when we start removing these things, IgA gets very much affected and clogged up by removing these organisms. IgA then in turn will secrete chemicals which can cause secondary effects in the body like sore joints, achy muscles, tiredness, dizziness, insomnia, the list goes on and on. So you can actually prevent a lot of these things from occurring by preparing yourself carefully for a few weeks before taking a powerful product like this. And a good way for you to do that is to cut back on alcohol, caffeine, drink more water, get more rest, start switching into a better kind of a diet. You can read a lot more about this on yeastinfection.org. I've written about this. I call it the big cleanup. So I've seen too many practitioners who don't clean patients up prior to putting them on Candida cleansers. It's very important that you do this preparatory work before you take supplements like Canxida. It's going to give you a lot less chance of any kind of what we call side effect or thing like that. Secondary thing I talk about will be taking too much too soon. All right. So this product here, if you start taking all of a sudden 6 or 9 per day, and you've not taken anything like this before, you may find within the first 14 days headaches, nausea, bowel changes. So if you are quite toxic or have not undergone detoxification, again I'd recommend you do a bit of a cleanup first and start slowly with a product like Canxida. Take maybe 1 tablet per day for a week, then go to 2 tablets per day for the following week, and then gradually increase. All right, and this is especially important if you've been smoking or drinking lots of coffee, tea, or alcohol, or tobacco, or recreational drugs or things like that, because this will mean you're very toxic indeed. But also for people who work in toxic environments, people who use chemicals, gas station attendants, people like that, people who clean carpets, people who work in foundries, all sorts of people with toxic occupations. Can feel pretty sick and spaced out. Even people working in offices with new carpets and new outgassing of furniture and that can get quite sick. So think carefully of your occupation, your level of toxicity, the diet. Think about the big cleanup. Think about starting slowly. These are ways you're going to avoid any potential aggravation. And if you do get an aggravation when you start this product, then just immediately cut right back to maybe 1 or 2, 1 tablet per day, and up the water intake and reduce other supplements you're taking, and you should be perfectly fine. Then you'll recover quite quick. All aggravations generally will die off well within a week, And usually the bad ones will last maybe 2 days, 3 days max, and then you start coming back to normal. Think about it like having a hangover. Hangovers last for 2 to 3 days, then they're gone. So hangovers are there to teach us not to get hangovers again, right? And side effects or aggravations should do the same. So think about some of those things I've told you, Terry, and I hope that gives you some good information regarding side effects, okay? Thanks for tuning in.